So cataract, as we know, I said that the lens within the eye sort of opacifies, and that is what is called as cataract. So no matter what we do, we cannot reverse this process. There are no medications to reverse this process. We need to understand that the blurriness of vision that a patient comes in, and if the diagnosis is cataract, it's not going to get better by any drops or giving a new pair of glasses. The treatment is going to be a surgical one. You need to discuss with your doctor that at what stage you would like to do the surgery. In an early or an immature cataract, I would say that you still can wait maybe 2 months, 3 months, or as per your convenience. But in cases where your doctor does say that the cataract is hard, or it's mature, or your vision is severely dropped down, or you're a patient whose sugars are not under control, I think earlier is the better one. So, like I said, treatment is going to be surgical. So once diagnosed with cataract, like we said, that the treatment is going to be surgery. Now this surgery is performed in various ways. Initially, we would perform it where we would do a large incision surgery, which we no longer opt for. Now we go in for a micro-incisional surgery where no stitches is there would not be any pain, and then no patch and no injection. So times have changed, the surgery has become very much advanced. Now, in cataract surgery, what we do is with the help of the phaco machine, we remove the cataract and we place an artificial lens within the eye. So now this lens is going to determine how one would see after the cataract surgery. So your doctor is going to discuss with you what are the different lens options that are available. But before doing this, we need a couple of blood tests that have to be done to see if you're systemically stable for us to operate. Once the blood tests have come normal, we will subject you to various scans. The most important one being the lens measurement, what we call, which we do on the latest machine, that is the ILMaster 700. So this machine, basically what it does, it measures the length of your eyeball, and it helps us decide which power of lens we need to put within your eye. So the lens measurement is going to be very different for every individual. Once the lens measurement is done, we even map the front part of the eye, that is the cornea, to see if there are any irregularities for which we must take special precautions during surgery. These are two basic investigations that we do before every surgery. The further tests that are done is we do a scan of the back part of the eye, that is the retina, in diabetics especially, or in cases where the retina is not visible clearly or we find certain changes. Now, why is this retinal scan important is because the retina plays a very important part in vision. So if there are changes within the retina, we need to treat that, or we need to also inform the patient about it, because that will affect the prognosis of the surgery in some cases. So retinal scan, that is known as the OCT, is performed at our clinic itself.